My name's Amanda and I am one of the hygienists at Springfield Dental Care. So I'm going to be talking to you today about interdental cleaning. So interdental cleaning is basically cleaning in between your teeth. This is really important. With the best will in the world, your toothbrush is never going to be able to access all of these nooks and crannies. So what you need to be using is things called interdental aids. Loads of different things out there. Today I'm going to be talking to you about floss and brushes, and I'll show you how to use them. So the reason it's important to clean in between your teeth is it kills the bacteria. If this bacteria isn't killed, it sets hard into tartar and then you can't brush it away. That's where us hygienists and dentists come in. The other reason the bacteria is important to clean away is it goes into your bloodstream, so it's not very good for your body. So it causes lots of inflammation in the body, which is linked to things like heart disease and strokes. The other thing it does is it causes gum disease, also known as gingivitis. The way it causes gum disease is your body doesn't want it, so it sends white blood cells there to fight it and causes inflammation, which also causes bleeding. So the way to cure this is to clean it off. So what you need to use is something with physical brushes or string to get rid of it. So we'll talk to you first about floss. So there's loads of different types of floss out there. Whatever brand you want to use, doesn't matter. They all do the same job, just whatever you're comfortable with. So this one, for example, is a satin floss. So it's waxed. So that's quite nice. It helps it glide in between the teeth a bit easier. So you just pull it to the desired length, snap it off, wrap it around your middle fingers and then just hold it tight. And what that will do is enable you to go around every single gap in between the teeth. The other type of floss you can use is super floss. So here's one I prepared earlier and I'll show you what's so super about this. So super floss has a stiff, thick end. So super floss is really for people with bridges and crowns and implants. So it has this stiff end, as I said. It also has a fluffy bit in the middle, which then tapers off into thin, normal thickness floss. So what you would do, you would just thread it in between the teeth, pull it through to the fluffy bit, and go underneath your bridges with it, and then back again and pull it out. So you might see some debris on here, you might not. What you're actually aiming for is to not see debris on your interdental aids. When you see debris and bleeding, that means it really needed doing. When you don't see anything, that's good. That means you've not got a lot of bacteria. So the other type of floss you can use is one on a stick. These are also called harps. I like these. These are good for getting to your back teeth with. The other thing to note is these aren't single use. You can get quite a few goes out of one of these. The reason being is the bacteria that we're trying to kill can't live in oxygen. So as soon as you run this under a tap afterwards or expose it to the air, the bacteria dies. So obviously when it snaps you need a new one, but you get quite a few goes out of it. Also as well, there's a toothpick at the end. These are quite handy if you've got something stuck. So I'll show you how to floss. So the point when you floss is just to go slightly below the gum as far as it lets you. So this is completely normal. There is a little lip of gum that's not attached to your tooth, and that's where the bacteria gets down. If you're not managing to clean it and the bacteria sets hard into tartar, it starts to eat away and create something called a pocket, and then you've got a big lip of gum around the teeth, which isn't ideal, and this is what we're trying to prevent by using things like this. So as I said, you go down slightly underneath the gum one side, and then you would do the other side to the adjacent tooth. For example, if you didn't have a tooth next to it, you would just do that one side. It still needs flossing. I'll show you how to do it. So you go down underneath the gum and then that's the other side. So I'll show you in a different area just as another example. You go in one side and then do the other. So you're just going slightly underneath. Again, you don't want any blood on here. So the other thing that you can use, which are good, are brushes. So these come in a variety of sizes and a variety of brands. Doesn't matter what one you use, brand wise, again, whatever you're comfortable with, but you should use the right size. So if you're struggling to work out what size you are, just ask your dentist or hygienist. We can size you up. More often than not, you're probably about 2 or 3 different sizes throughout your mouth. I'm just going to show you with this one as an example. So what you would do, again, get as close to the gum as you can, go in between like so. So I'll show you again here. So if you're struggling to get to your back teeth, what you can do is bend it. That makes it a bit easier to get to access. So you kind of go right between like so. The other thing you can get if you're struggling is ones on a long handle. So these are good as well to get to your back teeth, or if you've got any dexterity issues like arthritis. If you're still struggling, or if you prefer, you can use a plastic one. These tend to come in about 2 different sizes. These will fit in between all of your teeth. They're really good actually, and they're quite solid. They'll last quite a long time as well. So again, in between. So floss and brushes do different jobs, as I said. So the floss will do the length of the tooth and underneath the gum, whereas the brushes will push the debris through and kill the bacteria. But for example, like me, I've got retainers behind my front teeth, so I can't actually physically floss there. So these are good for cleaning in between where the floss won't get to. So again, as I said, if you're struggling with sizing, come in. We'll tell you what size you need to use. Obviously, we have to look first. We can't just guess. Try not to use your wife's or your husband's because everybody's different. But, at Springfield Dental Care, we can advise you on what one to use and how to use it effectively so it lasts a bit longer. So I'll leave it here as I've waffled again. Take care. See you all soon.